Just takes one moment to set it up. Good afternoon, everyone, and welcome to the 14th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. These calls are held every weekday at 5 p.m. Eastern Time and are free and open to the public. My name is Scott Knowles. I'm a historian of disasters at Drexel University in Philadelphia, and I'm the host of these discussions. We are streaming on YouTube Live. The link to this discussion can be found at the Scott Knowles YouTube channel. Has come to my attention. There are many Scott Knowles YouTube channels, but this is the only one dedicated to the COVID-19 pandemic, so you can locate it that way. You can also email me directly, sgk23@drexel.edu, or find me on Twitter @US of Disaster. Please do help me spread the word for these calls. Send suggestions for guests and topics, and please feel free to suggest yourself. You can also hear these COVID-19 calls recorded as podcasts. Just go to soundcloud.com and search for the Slow Disaster Podcast. Tomorrow, we have a double header of COVID calls. I think I'm missing baseball season. At 4 p.m. Eastern Time, we have Princeton political historian and CNN columnist Julian Zelizer to talk with us about pandemics and politics. And at 5 p.m. Eastern Time, we'll have a discussion of the full COVID-19 story from the South Korean perspective with Professor Cheong John of the Korea Advanced Institute of Science and Technology, KAIST, and Dr. Sung-Sik Wong of Seoul National University. As of today, there are globally 998,047 confirmed COVID-19 cases, according to the Johns Hopkins University Coronavirus Resource Center. This is up from 911,308 cases yesterday. 234,462 of those cases are in the United States, up from 206,207 yesterday. But as I've said, colleagues I speak to in public health and medicine tell me that those numbers are low. There are now a total of 5,648 deaths reported in the United States, up from 4,542 yesterday. A new number I'd like to share with you is that the Johns Hopkins Coronavirus Resource Center now reports 8,861 survivors of COVID-19 in the United States. That's people who've recovered. So as I was thinking about today's COVID calls discussion, I was thinking about my family. I've been thinking about my family a lot lately, as you all have as well. And not just the family inside my shelter in place home, but my 6 brothers and sisters, my mom and my stepfather, my stepmother and my father, my nieces and nephews. I have one wonderful remaining grandmother who's still with us. And naturally, family has been on my mind. It's been on all of our minds in this pandemic. I keep in touch with them through so many different means. I've lost track now with my parents via text and by phone, and I'm used to them being far away, but now they seem very, very far away. They live in Texas. I live in the East Coast. There have been some tough discussions lately too, around curtailing social events and travel, and the concern has flowed in both directions. This isn't really different from the normal ebb and flow of family discussions maybe, but somehow it's more charged now. Actually, I think it's much more charged. We don't want our loved ones to get sick. We want them to follow the best advice of health authorities. But for me, this has been a problem. Texas hasn't been on lockdown. Even the governor won't use the shelter-in-place language. Some employers, and this affects my family, have up until very recently been asking my family members to come into work, and one of them is still doing so, even though it's not really necessary. So these things have been on my mind. It hasn't been easy. It raises issues of communication across generations. It raises issues of care and concern for elders. So I wanted to talk to some experts in these areas who could help me think through this a little bit. So with that, let me introduce my guests today. Bernadette McBride has a master's in nursing from Gonzaga University and a master's in health education from Whitworth University. She's a registered nurse practitioner in Washington State, specializing in geriatric family practice. Bernadette has been the owner of adult family homes, legacy management, and Tranquility Life Care in the Tri-Cities area of Washington State for 25 years. For her first master's degree, she focused on death and bereavement of parents who lost children to sudden infant death syndrome. Dr. Sara K. McBride, and yes, she's Bernadette's daughter, has a Ph.D. in media studies from Massey University. Sara has a master's degree in public administration from the University of Hawai'i at Mānoa, with a concentration in disaster management and humanitarian assistance. She's currently a Mendenhall Fellow at the U.S. Geological Survey, where she studies the communication of aftershock forecasts and earthquake early warning. Sara also has 16 years of emergency management practitioner experience. And among the many things she did in that context, she was part of New Zealand's H1N1 response in 2009. And our third guest today, colleague of mine at Drexel, Yvonne Michael, Associate Professor in Epidemiology and Biostatistics at the Drexel Dornsife School of Public Health. Yvonne's research is focused in three areas: active aging, women's health, and health disparities. The unifying theme across her research areas is the use of epidemiology as a method of inquiry to identify social characteristics of communities and individuals and describe the impact of those factors on population health. So we have three wonderful guests today. I'm really looking forward to this discussion. Thank you all three for joining us on COVID Calls today.
Thank you.
So I'd like to encourage those who are watching and listening to ask questions. You can ask questions in the YouTube live chat, or you can email them to me, sgk23@drexel.edu during the conversation. You can tweet them at me, just tag USF disaster, reach me however you can and get questions in for this discussion. So enough from me. As we get started, I'd like to turn to you, Bernadette, first. And as I've been doing in these calls, I've been asking people if they would just tell us about the situation where they are. So could you bring us up to date a little bit on how things are in Eastern Washington State right now?
Yes, I just checked on our statistic here in the Tri-Cities, which is in the southeastern corner of the state of Washington, about 30 miles from the Oregon border. We have a population of about 300,000 people in our community. The health department says as of today, we have 189 cases of tested positive virus, and we have had 7 deaths. Most of the cases have been in long-term care.
Okay, so thank you for that update of the situation there. And I wonder, we'll stay with you for a minute. Can you tell us a little bit about your background and how you got into the profession you're in and your work there?
Sure, I've been a nurse, as I said to Sara, since the Punic Wars in a long time. And at some point I got sick and tired, and so I got a master's degree in health education, public health kind of thing. And I work primarily with family as a consultant for the state of Washington, who had lost a child and was dealing with grief and loss. And I did that for like 7 years. And then at some point I decided I wanted to take care of people in a smaller environment with fairly minimal bureaucracy. And so I started adult family home about 25 years ago. We had up to 6 homes. They're basically the bed and breakfast of long-term care. And we have a maximum of 6 residents per home. They're all usually over 80. And we have a philosophy of aging in place. So we do a number of hospice care as well. And we take care of our residents in very nice settings.
How many residents are you presently taking care of there?
Well, I have I have 3 homes of our own that are staffed right now. So I have like 14 right now. And then I also oversee the care of 3 other homes as well. So total is about 32 residents that I'm the primary care provider for those residents.
And that's 32 residents multiplied by all of the family members who are
And
turning
staff.
to you for information about them constantly. So that's a big community of people to which you're the point of contact.
Yeah, I
for those
feel I'm
concerns.
like 75 people to 100 people that, you know, have to be nurtured.
Wow. Okay, well, we're going to come back to you and talk a little bit more about what that nurturing has looked like in these last few weeks. But Sara, I want to come to you. Can you give us the lay of the land there in the Bay Area, California?
Yeah, I'm in Santa Clara County. I'm actually in Santa Clara right now. And we were one of the first areas to record COVID cases. We received our shelter-in-place orders on a county level on the 16th of March, and shortly there was a shelter-in-place order for the whole state of California after that. We've had the second largest amount of, per county, we've had the second largest amount of cases and I think deaths in California, with LA County, of course, being significantly more impacted so far. It's a really unique, and the Bay Area is so lively, and there's always so many people here. And you know, we're in the hub of Silicon Valley, so there's constantly cars and airplanes and noise overhead. And the first day that the shelter-in-place orders came into effect, I woke up at 6 a.m. and there was no noise, there was no traffic, there was no airplanes. It was completely silent, and it's the first time I've heard the Bay be up, just this sort of blanket of silence going over the Bay, and it was a real discombobulating experience for the first 72 hours of the Bay being so quiet. And now some normalcy has returned to this, right? There is now some more traffic. People are now getting used to what is happening. So overall, you know, things are okay. I know that there are a lot of people impacted, including homeless. We certainly have a homelessness issue within the Bay Area, and that's a significant problem here. But in terms of personally, there's been disruption, but not, you know, a huge amount of disruption to me personally.
Well, the U.S. Geological Survey has enormous responsibilities in the United States for warnings. I mean, are there essential personnel who are going into the office, or is everyone's working from home? How's that working?
We're following the directive of all the county, state, all of our government officials. All of the warning systems and systems that we are currently managing are being well taken care of in accordance to any local, regional, local, state, and federal levels. So yeah, things are still operating, up and running, still doing the job.
And local rules apply. So we got a bunch of scientists who are running the USGS from their houses and apartments right now.
As pertains to any local, state, or whatever governance structure that they're under. So we're all working together, though.
It's remarkable. Thank you for that. Let me turn to you, Yvonne. What's the situation in Philadelphia right now?
Yeah, so we have been on a shelter-in-place order from the city since March 22nd. And so similar to what you've heard, significant restrictions on business activity, personal activity, congregation. So like Bernadette and Sara, I've been home for several weeks. It's very quiet in the city where I live. I live in University City near Drexel and University of Pennsylvania. So all the students have gone back home. So it's very, very quiet, strangely quiet. There was a little bit of excitement because the sanitation workers had a labor action the last couple of days because they didn't have adequate protection in their contract for the hazard that they had to face to pick up trash. So last couple of days, we had no trash pickup. So on top of the silence, there was a ton of trash because lots of people had moved out. But luckily for us, and hopefully for the workers, they've got adequate protection and they're back to work. So cleaned up. Cases, according to the city of Philadelphia, we have 2,100 cases in Philly.
I receive emergency alerts pertaining to Philadelphia, and I got one the other day that said emergency alert, and I thought, well, that's strange to receive it at this moment. Is it related to the pandemic? And it said, there's a protest at City Hall. People are driving around City Hall honking their horns as a form of protest. So that's, it's very hard to kill the Philadelphia spirit of dissent.
Very true, very true.
Yvonne, could you tell us a little bit about you have a varied portfolio of research, but could you just take us a little bit inside to the kind of questions that you work on the most?
Sure. So as you said, I'm an epidemiologist. I work at the Dornsife School of Public Health. I teach classes to graduate students on research methods. I do have a varied portfolio of research, but a good chunk of my research includes a focus on healthy aging. So unlike a lot of the epidemiologists you've been talking to and hearing from these days, I don't work with infectious disease. I focus on the identification of factors in the occupational, social, built environment that influence healthy aging. So how can we keep older adults maintaining their function, both physical function, mental function with age? And so one of my newest projects is to understand how we can tailor disaster response systems to aging adults' unique vulnerabilities and resiliency factors. So that's a new area for me, and I'm excited to be learning more about disaster response, but I am no expert except for what I'm going through right now.
Mm-hmm. So there's I think here an important overlap, Yvonne, with your research and with Bernadette's everyday experience, which is taking care of older folks who are in various states of health, I'm assuming based on, various different kinds of health factors and vulnerabilities that they may have. And Bernadette, I want to come to you actually. If you could just tell us a little bit as we start, how are your residents coping with this? What level of concern do they have? What kind of measures have you been taking around the pandemic? And also, I want to know how their families are coping with this.
Well, there is no question that it's hard. There's no question about it. We used to be a very vibrant community with a lot of gathering, family type meeting around the table. We have an activity directors that would do exercise, group exercise, sing along, all kind of things all day long. Now with this not being able to be less than 6 feet from each other, there is no more communal eating, people eat in their room. There is, it's just missing this. They don't get the hug they used to get every day from all of us because we are being careful. That is changing. Now we're trying to, now that the first wave, the first shock of what we had to do is starting to fade a little bit, we're starting to do things a little bit differently to increase the morale. So we put Elvis Presley's music quite loud so they can hear it everywhere in the house. We have tried to do bingo from the outside of the room, and then we yell really loud the numbers. It's not the same. They obviously realize that something is different. Some of our residents have dementia and they're just kind of bewildered because we all wear masks and gown and all this kind of thing. It's hard. Now for the families, what we have a outside each rooms outside. We have long patios, and they can come behind the windows, and we open the window a little bit because the weather is nice, and they can talk either on the phone and see each other. And as long as they're far away enough, 6 feet, then it's okay. And the grandkids can come and sing along and do that sort of thing. So we're trying to keep this up with them. We are trying different things, and when we're finding new things to do every day to make life a little happier for them.
Bernadette, who do you turn to for the health information, the public health information that you need? You're relying on Washington state officials, more local officials. Where are you turning for the guidance you need to take the steps that you need? Even you said the use of masks or how, distancing, the different kind of steps you've been taking there to keep everyone safe.
Sure. There are several webinars almost daily with the SHS, with public health, so on and so forth, that I can approach or get on or have my staff listen to. They send us all kind of communications that we print for like the staff, and they have to read and sign, so everybody is on that same page. So I've been in this community a long time, so I'm very good friend with the head of public health here, and so I stay on the loop. As far as supplies, we're doing okay. As a matter of fact, I just got this. I don't know if you can see that. I got it. We have all kind of wineries in the state of Washington. So I went to the distillery and they gave me this bottle that we can do our own hand sanitizer. So we're doing okay with the supplies.
Could you hold that up one more time just so everybody gets a look at that? This is a special vintage of hand sanitizer, it looks like.
Yes.
That's extraordinary. Warning, do not drink. I'm glad it has that important health information right there on the label.
So wow. we mix it with glycerin, and then it makes great hand sanitizer. That's my second bottle. Luckily, thanks to Sara, who has trained me very well for the last 15 years. She's really good at telling me where the dangers are and what I should be ready for and what to do in case of earthquake and tsunamis and all those sort of things. So she told me one time, she said, in case of a tsunami, Mom, don't run for the fish that are flopping around and run for the hill. So I translated that when it happened. Don't run for the wall, for the paper, the toilet paper, but run for the PPE. And so I got a lot of supplies, boxes of gloves and gowns and masks and so on. So we're well stocked. And also we have a school to train CNAs. And of course we stopped the school, and I had all that supplies, that PPE supplies from the school that we raided for the adult family homes.
Thank you for that. It's really extraordinary details. I'm getting text messages and tweets right now about your strategy of blaring Elvis as a way to cope with the disaster. I want to come to you, Sara, and then to Yvonne, particularly around this issue of aging populations and disaster and public health. What kind of issues or tensions are being thrown into relief right now? The kinds of concerns that you have in emergency management, let's say, Sara, around vulnerable populations, aging populations. What is the pandemic showing us? How are we prepared? How are we ill prepared? Can you talk a little bit about that?
I think I'm going to hand this over to Yvonne if you want, because I'm not necessarily studying the elderly in specifics at the moment,
sure.
or a specific vulnerable population for my current work. I think Yvonne is actually much more qualified to answer this question than I am.
Okay, Yvonne, go ahead. Then we'll come back to you, Sara, in a minute.
Yeah, well, I mean, I think that from a coming out of the research that I've done, one of the things I've been thinking a lot about is social connectedness. Social isolation is a really important public health issue. We know that social isolation is associated with increased morbidity and mortality in the best of times. And with this current disaster, as we've all been talking about, we're forced to isolate ourselves, and especially the older population is very vulnerable and needing to stay distant from those systems of support, their fellow residents, the families and friends that don't live with them directly. And this loss of social connectedness, loss of support from families and friends can be a big health issue. Can in some very tangible and intangible ways. You have the emotional support, of course, which is intangible but very important for health, well-being. And then you have the tangible support, the family that was coming into the nursing home and making sure the medications were correct, making sure that there were no bed sores, for example, and none of that's happening right now in a lot of places. So that's a concern for the older adults. It's also an issue for the families, where families are in positions of knowing that their loved ones, parents, elderly residents are elderly family members are sick. They're not able to visit them. They're not able to see them. In many cases, not able to be with them when they're dying. And so there's just a lot of loss and grief in that that has, again, really important health implications. So that's a lot of what I've been thinking about.
Yeah. Sara, let me return to you. I know, based on what your mom was saying, she was sharing with us there moments when you took an opportunity to provide her with valuable emergency response information. You're an expert in alert and warning in many different contexts. Can you tell us a little bit more about your research in that regard? And if you would, be willing to talk a little bit about what you've noticed in this pandemic in that regard. Any aspects of alert and warning in your own research you want to talk about?
Thanks for that question, Scott. So I just wanted to give an example of another time that I helped Mom out with a little bit of information that I had. Because I knew that there had been an earthquake in Walla Walla in 1936 that had been a magnitude 6-ish, not a small earthquake. I knew that there was some potential for earthquakes in my home region. And so I called my mom and I'm like, Mom, you got to get earthquake insurance. And she's like, no. And who do I even call to get earthquake insurance? So she called her broker, and it took them a couple of weeks, and they finally found someone to get them earthquake insurance. But they're like, earthquakes can happen in this part of the world. And then the 6.5 happened in Idaho. And I was like, see, Mom, these things can happen in places where it might be 30 years since the last earthquake. But, even though it may not be as frequent in your area, it doesn't mean that, you're free of earthquakes necessarily. So I think Mom is a little bit grateful that I made her get earthquake insurance. In terms of alerts and warnings, so I wouldn't say that I'm necessarily a warnings or alert expert. I think I specialize in disaster communication, and alerts and warnings are definitely a really important segment of that communication. And I'm working on that earthquake early warning system at the moment. And it's really breaking down how people understand alerts and how quickly they can take action, given we know that the earthquake early warning system can only provide seconds of warnings, as opposed to other warning systems, which can provide a lot longer. Say, when you're looking at hurricanes, which can provide, 10 days potentially of warning. So you have varying levels of timing in terms of when people can take action. In terms of this event and how warnings are being used, I think it's a pretty complex question still at the moment. It's so moving at the moment, and things are constantly changing. And the way that this is moving from community to community is different. And so to apply one standard to one geographic area in terms of timing, I think is a really complex endeavor at the moment. So I think it's something that will have, I think more time needs to pass before we can be really critical and thoughtful in terms of how warnings were used, because it's still such an evolving situation. And every country has its own way and a way of delivery and jurisdictional issues, and so it's I think right now I think it's still really evolving.
Sara, I wanted to keep going on this because I'm really interested in sort of the research frontier around trust and communication. And, I think looking at the research after September 11, for example, about, with evacuees, people who got out, And who did they turn to literally in the hour that some of them had to make a decision of how they were going to evacuate. We learned a lot after that, and I think after Katrina as well, but there's still a lot of unknowns. As I understand it, authoritative public officials certainly carry an important role in that moment, but we also turn to networks of trust too. I know it's hard to generalize, but could you take us into this discussion a little bit? Because I want to then build on that to talk about parents and children talking.
Well, so recently, I think it was Louisiana had the head of their football coach go to a press conference and talk about his perspective. And he used the standardized key messaging. And some people sort of felt like, well, why is a football coach standing up there? And my thought is
that's people who've never been to Louisiana would ask that question. Yeah.
And I'm just like, he's a trusted, beloved public figure, and the messaging is right, and they're doing the right thing. And if it takes a football coach from Louisiana, then it takes a football coach from Louisiana. Like I'm perfectly I'm at peace with that approach. And I think the research tends to indicate that multiple sources of information amplifying the same or similar messages tend to increase the levels of trust. So when you're working, with community groups or with, in levels of community, yes, you want one consistent message, but having multiple people or groups amplify it, I think is a really important component as well. And I'm seeing a lot of that happen, which is wonderful.
This is a question that actually came up. I was speaking with some folks in Philadelphia the other day, and they were really asking hard questions about how in this moment, particularly in a disaster that's playing out over a period of time, how could we stimulate targeted messaging? You're talking about the football coach. That's an obvious one. I think a good one for Louisiana, it might hold in Texas, but Philadelphia, for example, very diverse city, very diverse region. Should we be thinking about those kinds of strategies down to individual populations, age groups, parts of town even?
Yeah, I think that it depends how much resources any one group has to do this kind of legwork, to get the right community leader or person to do that piece of work. I'm just a big believer in different people amplifying the messages, and the research really holds that to bear. That we know that if you give someone a booklet or a piece of information and it has one logo on it from one organization, that has a lot of weight to it. But if it has multiple logos from multiple organizations all backing up the same message, then that also seems to have a lot of impact. And I think one thing that's really heartening about this event is how many organizations are working together all at the same time to manage this response, and how emergency management is bringing all of these many threads to work on this particular event. And that's really how emergency management is meant to work. So I really applaud my emergency management colleagues. I think a lot of them are working some very, very tough hours, some long hours.
Yeah, absolutely.
And
sure.
Yeah.
One of the reasons
Does that answer your question, Scott?
Yeah, no, absolutely. And one of the reasons I was so excited to have you all on today, and if I could speak a little more personally, the sort of getting to these issues of trust and family, and in difficult times communicating across generations. My parents live in San Antonio. They were not getting consistent. They were getting different information from the federal government, the state government, and the city. And they were, I know, looking for good, sound information they could rely on. And it's been hard for them. And that's been hard for me. I'm a disaster historian sitting up in my office, 1,600 miles away. I can't give them the information. I can express care, but I can't give them what I think the kind of information they need to know. Should they go to church or not on Sunday? And that's the level at which a lot of these discussions have come down, I think. I don't know, maybe Sara and Bernadette, if you would you mind sharing with us a little bit, even at a personal level, kind of how your communications have worked in the last few weeks around this disaster?
Well, just with my husband, we had to have this conversation because what happened when somebody is diagnosed, they usually are taken to the hospital, and that's the last time you might get to see the person. So I had to approach that. Now, I've been working with death and dying for a long time, so it's kind of, fairly natural for me to get into that. And I basically said, hey, you know that life is a sexually transmitted disease or condition with a terminal diagnosis, don't you? And I said, so maybe we need to talk what could happen if this happened to us. And I said, first, I want to get all of your passwords because I wouldn't be able to function if I didn't get that. But I need to know from you, what do you want to see happen? It was hard because he had the impression that, well, you just go to the hospital and they put you on a ventilator. And then, statistically, you have a good chance to get better. And unfortunately, there's only 20% of people that have been put on ventilator that actually will recover. So it was important to say, what do you want to see happen if you get sick? How do you want things to go on? For a funeral, for that sort of thing. It was hard for him to talk about it. And he kind of cut me short after a bit because he was trying to process that. And I went planning to go back to it because, frankly, it is a potential. We are in that age group.
Sarah, did you want to share anything on this point about communication, family?
I mean, I talked to my dad about it last night, and he just sort of sighed after about 2 or 3 minutes of our discussion, and he said, my father is a nuclear chemist, and he's like, I just wish people would stop talking about COVID and start talking more about plutonium. And which I was like, I don't know if that's the conversation we're going to be having right now, Dad.
Yeah, sorry.
Sorry, Dad. So I can see Dad kind of being like, oh, this is a lot for me to handle. I mean, for me personally, and the communications I have with the people in my personal life, I've been on a lot of deployments overseas for disasters. Responded to the Samoa tsunami in 2009. Worked in the Christchurch earthquake and in a lot of earthquakes in New Zealand, and did a Cat 5 in Fiji, and just did, I've done a number of deployments now, and I look at it in the same way I look at it preparing for a deployment, and I communicate to the people I need to about it as a deployment. So one of the first things you do in a deployment when you get the call is you make sure your affairs are in order, that your will is ready to go, and everyone knows what who needs to knows what the next steps are. And so that's kind of where I've gone to it. So like a small example, I put together my research will, which sounds really dark, but it's basically like, if anything happens to me, here's where all my research is, here's where my in vivo files are, here's where my qualitative analysis is, and here are the researchers who can finish my work and get my papers published. Because I was like, well, I spent all this time being a researcher and I love my research so much. I don't want it to go with me. And so, here's a 2 or 3 page document about keeping my research going in case anything happens to me. And even though this is impacting, more in the mortality rate of the older age group, there is cases of younger people getting sick and passing away. So I don't think I think these are good things. These are good practical things that we can do. And then we can communicate those to the people we care about after we're gone and before. So having these conversations, I think, is a coping mechanism in and of itself.
I mean, to me, it seems like these are conversations, of course, that are had between parents and children and brothers and sisters, but they're not usually had all at once. You know, I mean, what you're describing, I mean, you know, it's a lot to take on one of these conversations on its own, but then let's have the passwords talk and the DNR talk and the insurance talk all at once. I just think that's, I don't know. I mean, Yvonne, I know this isn't your like area of research per se, but I just wanted to turn to you on this. I mean, do we have, from a public health perspective, some understanding of the tensions of having to have these kind of difficult talks in the midst of disaster?
I mean, I think that in general, we have a hard time with these types of conversations, and talking about death is something that people, maybe particularly in the US, I'm not sure if this is a US thing or not, but certainly here we have a hard time talking about it. And so, you know, I think a lot of people may be avoiding it still, but I really resonate with the things that Bernadette and Sara said around the kinds of conversations I've been having with my husband, with my parents, probably not as much with my kids as I should. You know, my kids are teenagers, but it's not too early to have that conversation with them. So I guess I'm not speaking from a public health perspective, but more from a personal perspective. These are really hard conversations to have, and there's a lot of stress going on in general right now. So if you haven't had these conversations yet, it's not too late. You know, and I think that the most important thing right now is to, you know, reach out to those people that you need to have these conversations with, and first just let them know how much you love them and how much you care about them, and make sure that you have your connections strong, and then start thinking about those preparedness conversations that we also need to have, and getting those things in order. So it's not easy.
There's a lot of disaster social science that shows us the many different ways that people are pro-social in disaster. You know, they help, they're resilient, they're creative, they seek information. But I think usually that kind of research, at least I know from the history of that research, it was done because public officials were worried that society would fly apart at the seams in a disaster, and they wanted to be reassured that we wouldn't. What you were just describing, Yvonne, I think is very powerful, because we have to also sort of turn that knowledge inward and say, even within families, distances can grow within family, physical distance, geographic distance, emotional distance. And that this is also a moment in which families are pro-social, families are finding each other again, and maybe raising, as you said, questions and issues that we wouldn't like to discuss all at once, but this is where we are with this. Bernadette, I wanted to come back to you because I know one of your areas of knowledge, deep knowledge and experience is around grief. And, you know, just 2 days ago, the President of the United States gave one of his press conferences, and he said, the next 2 weeks are going to really hurt. And it was a really jarring statement. It was jarring the way he put it. And it got me immediately thinking that we have to take stock of how well prepared we are as a society and individuals to deal with grief. And again, you know, disasters, often they seem like events, they sort of happen all at once, and this one is playing out over a slow period of time. Can you share some of your wisdom with us around grief and how you think about that in your own work there?
Oh, I'm not sure I'm an expert at all on that. You know, right now we are in the reactive preparation for a potential event in our communities. We haven't had that, so we have been in the what if mode. What if this happened? What if that happened? So we haven't quite hit the emotional level of grief. This will be coming when we start losing residents. Now, because we do hospice care a lot, we're pretty familiar as a team to deal with loss of residents. But we have focused on the physically preparedness We haven't really focused on the emotional preparedness, which I know is going to come, to be totally honest with you. We're more in we passed the denial phase. I think the younger staff are concerned that they are maybe sacrificing their life for all people, kind of talk. And some of them, very few of them, have backed off because they don't see the point of they're afraid. They're clearly afraid that they're going to get sick. So we're bracing ourselves for that wave that we know is going to come. So we do a lot of nurturing the staff. We emptied one of our homes, and that's our crash and burn home. We decided to empty one home, move all the residents to the others' houses. And this is just in case a staff member who is single, who doesn't have a lot of support, gets sick. We said, we will take care of you. We have the house and all those things ready. So we're your family, we'll take care of our own. And but I don't think the wave has hit. It's more like the denial, and the enemy is invisible. When you have a disaster that is visible, like a tsunami and all that, there is some community support. Everybody goes out to help and so on and so forth. We are doing the opposite. We are just going into our system, closing doors, not letting people out. So we don't have that same capacity of support from the community that you would get from another type of disaster. However, it's interesting. I just got a phone call a few minutes ago, because we're in the what if. And I said, what if we need more oxygen? Because Medicare only give oxygen on a one-to-one basis, but what if I have residents or staff who need oxygen? Because they're not, the hospital has no capacity to absorb those people. So I was thinking, well, I need to get some oxygen concentrators. And I got a call from an agency and said, hey, are you interested in any DME that we have? And I said, do you happen to have concentrators? And she said, you bet I do. And I said, can you bring me a few? And so right now, as far as I know, they're delivering me some concentrators that we will put in our crash and burn place. So we will have them readily available if it's needed. So we're not in very far in the grief process. We grieve our freedom more than anything else.
I wanted to thank you for that. And let me get back to you for a second, Yvonne. First, let me remind everyone we're talking with Bernadette McBride and Sara McBride and Yvonne Michael here today on COVID calls, and we have about 12 minutes left. If you want to get a question in, you can put it in YouTube live chat, or you can send it by Twitter or by email. Yvonne, I have to say I was a little bit, I don't know why anything still surprises me, but in the midst of this disaster, the starkly ageist claims that have been made in some quarters, and I wouldn't say it's been a majority, it's been a minority, but a vocal one, and some elected officials, and I'm thinking particularly of the Lieutenant Governor of Texas, who went on television and said, basically old folks have done fine, and they're worried about the economic future of their grandchildren, so they just have to get back out in society, and everybody just has to move along. And if that means the older population pay a higher price, then that's just the price of keeping our country going. Were you surprised by that, or were you expecting that kind of rhetoric in the midst of this disaster?
Yeah, that's a great question. I think that our society is so ageist in so many ways, in terms of what we prioritize, the priority we place on youth, on looking youthful, on acting youthful. And so people identify aging with unhealthiness. As long as you're healthy, you're not old. So it didn't surprise me to hear the rhetoric that has been pervasive around this pandemic, but it is disappointing in that the suggestion would be that, oh, you've lived your life, you've had your time, you need to move on so that we can ensure that the S&P index doesn't fall anymore is pretty hard to stomach.
And it runs totally contrary to, you were talking about earlier, the sort of frontier of knowledge in public health research, particularly around disaster response and people with chronic conditions, vulnerable populations, and aging populations. I mean, there may have been a time in which the notion of public health, emergency public health, or emergency management was about saving the majority, and that was that. But we're not there anymore. I mean, the frontier is that the vulnerable we need to be thinking about saving everyone, and saving everyone in acceptable ways should not be something we have to figure out in the middle of a disaster, right?
Yeah, I mean, I think it really does point to the fact that we have a lot to learn about disaster response related to older adults. It's a very, very heterogeneous population. You can't say that there's one. There is loss of function with age, but there's also a lot of change in that. People may lose function and then regain it. So it's not a single trajectory, and it's not a single downhill trajectory by any stretch of the imagination. So understanding all of that heterogeneity, and also understanding the differences in needs for that population, is an area that as that population grows and becomes increasingly heterogeneous, because we know so much more about how to keep people healthy longer, but we still don't know enough about how to maintain that quality of life in the later years. We have a lot more work to do with that. So I think focusing in on research that really understands for that growing group of people how to make sure that that quality of life is maintained, but then also how to respond with the increasing likelihood of increasing disasters.
Mm-hmm.
Sarah,
Sara,
quickly jump in on Yvonne's comment here, because she's absolutely right. I mean, obviously, fantastic expert. On elderly, there was a piece of research I did on shakeout, which is on the earthquake drill, which is drop, cover, and hold on. And we had thousands of observers observing people do shakeout. This is the shakeout paper I wrote about New Zealand from 2012 to 2015. And what we found was the major reason people didn't do it was embarrassment, but also age and fragility. And that, you have to have a certain amount of ability, a physical ability, to go under a desk. And not only that, but people were embarrassed to go under the desk about the vulnerability it showed. And the messaging has changed to include people with wheelchairs, include people with walkers and canes. But before that time, before kind of 2012, before we really had gotten into that, the messaging was really focused on able-bodied people and younger people who can complete the whole thing, rather than considering the needs of the whole group. And I'm really pleased to see that messaging has shifted and been informed by research to include sort of everybody on earthquake protective action.
Sara, I wanted to stay with you for a second and tap into your expertise as an emergency manager who's been in many different disaster settings around the world. We were talking about grief before, but particularly in the perspective of elders dying, being sick or dying. But emergency managers have some special training in coping, right, as well, and PTSD and grief. And I mean, we've never activated 50 states and 7 territories EOCs all at once in American history. This is a remarkable moment for emergency managers. are they ready to deal with the psychological stress of what's here, what's coming?
I mean, I think, and Mom and I have talked this a lot about how you prepare psychologically for responses. And I think it will be individual to individual. It'll be based on their training and based on their experiences, and based on their ability to cope. I don't think that there's anything wrong with any emergency manager who comes out of this experience and experiences anxiety or depression or PTSD. There's nothing wrong with with maybe their training or their experience. I think this is such a huge experience at the moment, and will continue to evolve. That I think that it is really, really hard to psychologically prepare for everything that is going to occur. And there's many things that like none of us have a crystal ball in terms of what's going to happen next, and where this is going to go and how this is going to evolve. But if it does become a horrific situation, I think that it will be completely understandable if our emergency management community is deeply impacted emotionally by it. I have a lot of compassion for that. Certainly, I've worked disasters that will stick with me forever, and this may be the same for many of my colleagues.
I want to get to a couple of questions here. A comment. We had a comment from Mitch Saminsky, who's in New York State, and he was really impressed with Bernadette's statement about grieving for our freedom. He thought that was a really useful way to think about what we're dealing with right now. And I want to share a question here from Jess Ballinger. And this is anybody who wants to take this question. Do you have a sense about whether there is a generational difference in how people are accepting public health messaging, particularly about the need to stay at home? This has been a common discussion on social media and in media generally. I think that there may be generational differences even between baby boomers and Gen X and millennials around whether or not they're following public health advice. Would any of you like to respond to Jess Ballinger's question?
On my generation, we're happy that we can have another nap. Okay, so staying at home is not a big problem. Unfortunately, I can't do it much, but I think you look more inward, and we're more, more insight into what we do. Personally, I need to lighten up when I stay at home because of all the things. So we've been watching like Monty Python movies and things that makes us kind of laugh, and that are lights, and doing like stained glass, which is one of my interests. So I don't have a problem, with that issue. Sarah, you want to talk about your generation of staying at home? I think you're doing some pretty cool stuff.
Well, I don't want to speak on behalf of my entire Generation X. I'm at the late end of Generation X.
That's very Gen X of you, not willing to speak on behalf of the whole Gen X. That's cool.
I think Scott. I think you're with me on like, I don't want to speak for everyone, but
yeah, totally.
I think the fact that we've had the Gen X has had the internet for 20 years, and I think we've been using it for a long time to come up with some pretty innovative ways of socializing and coming together and keeping in touch and working together. What I'm really fascinated with as a researcher is the use of different channels by different generations to communicate social norms and behaviors. Like, I'm seeing so many interesting things on TikTok, for instance, that are really getting into a younger generation on social norming around this, or on how Instagram is being used as a channel for social norm to reach a certain group of people, versus Twitter, which is definitely, and you have people across the generations using these platforms, but they are sometimes dominated by a certain age group. I think that's what I'm really fascinated about, is how these different channels are being used by these different groups to say, stay home. Here is wash your hands, cover your coughs and sneezes. Like, that to me is really interesting on how that information is being communicated by using these different channels. And then also the use of humor which is a big research part of what I like. A big part of my research is around the use of humor to communicate important messages. But yeah, no, I think that's what I'm interested in. How Gen X is handling it. Yeah, Scott, I don't know. What do you think? What can we say about Gen X and how?
Well, there were so many jokes going around the internet, and one of them was, Gen X, we grew up going home alone after school with a latchkey anyway, watching TV. We're totally prepared for this kind of thing. And so, these are memes and tropes, but, maybe they also speak to a deeper issue here that we've been talking about for the last hour, which is also the need to kind of break through those stereotypes and say, well, it's not what Gen X does or the baby boom generation does, it's what those two in conversation can do together. And I think it doesn't make for a very funny tweet, I realize, but I think that's much more the reality that we're facing right now.
It's much more popular to shade another generation, right? It's much more popular to say, like, these people are at fault, or blame the millennials, which is definitely a popular trope. And actually, it's none of those things, right? These are all everyone, I think, is handling it different. I think the great generational debate, maybe this will be a great generational debate equalizer, that we're all coming together as a community and a society, as a group, as a community, regardless of generation, to help lessen this event.
There was one more question. We're up on time, but I want to get to one more question here from Mike Fisher. Sara, to you actually. He was wondering if you could say a little bit more about different channels of information and which generations dominate which. In other words, in a communication strategy, do we expect that age will be a determining factor of how people will seek out information?
Yeah, so we're seeing what I would call a lot of uses and gratification theory, which is a well-known communication theory from the 1970s and onwards. And basically, it means that people seek out the channels which are most satisfying to them. It gratifies them the most to use. And we're seeing different generations flocking to different platforms because it most satisfies their particular need. Twitter, arguably, it's a great platform because you can have a short, informative, interesting tweet, and then you move on to the next, and it's just this constant churn. So for people who are wanting that constant churn, they get that sort of constant churn. And it has, humor and wit and brevity are the goals of Twitter, really. I mean, when you look at that, and when we look at sort of Twitter demographics, and I haven't looked at Twitter demographics for a while, but it tended to, like, I think 2017 was the last time I really looked in depth into it. But it was like think about like 29 to 49 was a group that often uses a lot of Twitter. Reddit tended to be a little bit younger. Instagram is definitely younger. TikTok is younger still. But you do see people, we do have 90-year-olds tweeting, and we have 80-year-olds using TikTok. So you do have those outliers coming in, or YouTube as well. One of my favorite YouTube channels is a woman who cooks meals from the Great Depression, and she's 98. And she's just delightful, and she tells all these great stories about the Great Depression, and she uses YouTube. So I think she did pass away a few years ago, but I've been watching her library, and I find her really interesting. So I don't know, I hope that answers. I would say any great communication strategy, definitely needs multiple channels to reach different age groups and different demographics.
So we're almost out of time here. I wanted to just get one more quick hit, Yvonne. This is for you. We've heard from Sara and from Bernadette in different ways about how this pandemic is changing the ways they work or the research that they do. Do you see something similar in public health research? I mean, first of all, how are we going to do public health research remotely for the next 6 to 18 months? But I know, it's a big question, but what's at the top of your mind on this kind of issue of how research itself is going to change in this moment?
Yeah, I wish I could answer that question. It's $1 million question for sure. And I think there's a lot of people thinking about creative ways. Been talking to colleagues who are getting surveys out in the field already to answer some of these questions about preparation, about communication channels. So there are people who are much more ambitious than I am, who have already jumped way into it. And and thank goodness for them, because we're going to need all of this information being collected in real time to really understand what was happening at this time. So I think it remains to be seen. I mean, honestly, the question you brought up about ageism is something I've been thinking about a lot, and thinking about, what it may lend itself to some research of using Twitter to see what kind of ageism is out there, and try to understand its impact on people's how they felt about responding within the context of this pandemic. So lots of interesting things. I love the idea of really understanding how different generations have responded to the requests to shelter in place. And there's been some interesting research that's come out suggesting that the younger people are actually more attentive to the shelter in place orders than the older population. And why would that be? Does it have something to do with the ageism that's out there that has been internalized? So I don't know, lots of great research. Right now I'm trying to keep my family like whole and together. So I haven't jumped in yet, but.
Well, thank you for taking this hour with us, Yvonne, and sharing your knowledge and wisdom. And Sara and Bernadette, thank you for joining us and also sharing a mother-daughter conversation in this moment, which it was really important. And I hope maybe we can come back to you as a trio. I hate to say this, but I think we're going to be grappling with this for some time, and maybe we can come back and reconvene this conversation later. I learned a lot from it. I want to thank you all for tuning in to the COVID calls today, and remind you that we have two tomorrow, 4 p.m. with Julian Zelazar to talk about pandemics and politics. And then at 5 p.m. tomorrow, Cheong John of KAIST in South Korea and Professor Sung-Sik Hwang of Seoul National University talking about COVID-19 in South Korea. Everyone stay healthy, and we will speak with you tomorrow afternoon. Thank you.
Thank you.